Hello everyone, my name is Heather, and the topic of today's video is neonatal abstinence syndrome, commonly referred to as NAS, which is drug withdrawal in a newborn infant due to drug exposure in utero. Syndrome occurs when babies are exposed to drugs in the womb, which causes them to begin withdrawal shortly after birth. You may be wondering which drugs. Mainly, NAS is specific to opioids and opioid withdrawal. However, it does encompass all illegal drugs, and prescription drugs. So, if a mother is taking certain antidepressants while pregnant, that could cause withdrawal symptoms in the neonate. Methamphetamine, marijuana, ecstasy, really any chemical substance like that, alcohol, could cause NAS, but traditional textbook NAS and its treatments and interventions are specific to opioids because opioid withdrawal causes the most exaggerated symptoms in the neonate. So the symptoms that we're going to be talking about, most of them are going to be specific to opioid withdrawal. However, you may see them in an infant withdrawing from any substance. Some of the common symptoms of this syndrome are high-pitched crying, sleep problems, sneezing, feeding difficulties, tremors, temperature instability, usually fever, and possibly even seizures. These symptoms are typically not present at birth and begin to present themselves within 24 to 48 hours after birth, when the drug has had time to leave the infant's system and they are now experiencing withdrawal. Comprehensive list of all symptoms that a child with NAS could be experiencing or exhibiting. So some of the ones that kind of stand out here that are different from withdrawal in an adult would be sneezing. If you're taking care of a newborn and they're sneezing, you wouldn't necessarily assume drug withdrawal, but that is a symptom and it is very common. Yawning is another one like that. Hyperphagia, so they just keep wanting to eat. They're hungry all the time. However, they're poor feeders, so they're hungry all the time. They have an excessive suck, but then when they do eat, they may vomit or not be able to finish feedings, and so they keep waking up frequently for feedings. Other ones that stand out would be a high-pitched cry. It's a very shrill and distinct cry, not the same as a regular newborn cry. Tremors, myoclonic jerks, an excessive Moro reflex. So that's the startle reflex, but it's to where they do that with every little touch. A newborn, there are some simple nursing interventions that can be done to help the process and provide comfort for the neonate. One example for infants experiencing tremors or hyperirritability or are overly hypertonic is just simply swaddling them. So you can see that this infant here is not in a swaddle. That is bad. We do not want to have an infant just laying there like that because the jerks and jerking movements will wake them up all the time. And then they'll be crying and upset. Instead, what you want to do is swaddle them as you see here. To feel more secure and the jerking motions will be less exaggerated. They're not as likely to wake themselves up from it or hurt themselves from those movements. So that's good. That's what we want to do. Nursing interventions that can be done would be to limit cares or bundle cares. And so that just means not bothering the baby for every little thing, allowing them to get as much sleep as possible and minimize stimulation. So while the baby is inside the isolette, only going in to do things when necessary and trying to group the care. So if you need to do blood work, do that right before or after feeding. instead of constantly bothering them. Also, and keeping the environment calm and as noise free as possible also really goes a long way with these neonates. They need as little stimulation as possible. So a nice dark, calm room is perfect for them. Stimulation can be upsetting for many NAS babies. A lot of them also do like touch and want to be held. So they don't necessarily like touches during cares, like a stethoscope on them or the thermometer under the armpit. Those things can be very, they're very sensitive to touch, but some of them really enjoy being held. Simple nursing intervention would just be holding. So, wrapping the baby tightly in a swaddle and holding close. You also have to keep in mind that these babies may not be going home with parents or family members due to the drug abuse. So, they may not have any visitors there to hold and kind of cuddle with them. So, that can be a nice, soothing thing to do. To assess the severity of symptoms and level of withdrawal that an NAS baby is experiencing, there is a Finnegan score sheet that is very commonly used in NICUs, and you can see it pictured here. So it's organized into three main systems that are being assessed. So they're looking for CNS disturbances, metabolic or respiratory disturbances, and then GI disturbances, usually involving feeding. So this scorecard should be used every time an assessment is done on the baby to see are the symptoms getting worse or are they improving? It is important to remember that some of these things can be subjective, and so there could be variance from nurse to nurse, such as modeling. One nurse may feel that the baby appears mottled and the other one doesn't. Or mild tremors versus moderate tremors. One could call it one could say the other. So, yes, there is some subjectiveness, but for the most part, this is a really standardized score system. And we use this to help figure out how to best treat the baby. If the Finnegan scores are low, typically below 8, we just do comfort measures and nursing interventions and just kind of try to help the baby get the drugs out of their system. If it's over an 8, then we consider pharmacological treatment. When the extent of withdrawal is severe enough, medical treatment is necessary in the form of medications. So the three most common medications used for NAS are morphine, methadone, and phenobarbital. Most commonly, morphine. This is for babies that are coming off of opioids. And so the idea here is to give them an opioid that helps ease the symptoms, but slowly wean them off of it so that they don't have dramatic withdrawal symptoms. Methadone has a similar action, but morphine is the more common one that we see in practice. Phenobarbital is specifically for the severe tremors and even seizures. So morphine's the one you see most commonly. The initial dosing on morphine is 0.04 to 0.1 milligrams per kilogram per dose. And so that is all based on the infant's Finnegan scoring. And so if the level of withdrawal is very severe, they would start the baby off on a higher dose. From there, if the Finnegan scores are starting to improve, they slowly titrate down. So it all has to do with the Finnegan scoring, and they slowly try to wean the baby off. Goals are mainly to keep the baby comfortable and happy as possible during this experience. Anywhere from days to weeks before the baby is able to be discharged from the hospital after fully undergoing withdrawal. Don't know if the baby is going to be able to go home with their family or if other arrangements have been made with CPS. The long-term goal is as little detrimental effects as possible. So hopefully the baby is able to make a full recovery and live a happy, healthy life. Blackboard for additional videos on NAS. There are some good examples of the symptoms that I've discussed today, as well as some of the nursing interventions. The end.